Won't go further with that one.
Just a reminder
We have our doctor
today,
today.
yes, we are celebrating ovarian cancer awareness. And today, joining us is a physician who is going to just add us some information as we.
Yes, we are going to be asking our physician this morning about cancer, ovarian cancer, and the attributes. What are some of the symptoms, how you can identify it early? Maybe,
Yeah, what we
how would you
can
know?
do.
I
And then
want to,
you see what the thing is, we have many listeners, men, woman, boy,
yeah,
girl.
and
You have a wife, you
and
have
is
a
ovarian
sister.
cancer, I guess I'm going to wait for that one,
don't,
wait. I'm going to
don't
wait for that
dare.
one. Doc, good morning, Doc. Good morning. How are you doing?
Good morning. I'm doing well.
All right. Well, we are here waiting for to hear. I have some
Welcome
pressing.
to the breakfast hour.
Welcome, Doc.
Thank
Welcome,
you.
welcome,
Thank
welcome,
you.
welcome, Doc. All right, Doc. We're talking about ovarian cancer today, and some of the symptoms that, of course, joining us this morning is Dr. Karen Lewis this morning, and of course, she is our physician on the breakfast hour today, and she will be talking to us a little bit about ovarian cancer. So, Doc, without any further ado, I'm going to let you have this matter, handle it for us this morning. Educate us on this matter this morning, Doc.
Okay. Ovarian cancer. I'm sure everyone knows what an ovary is, and that is part of the reproductive organ in a female. And now we have to say a female who has been assigned a female at birth.
What?
I'm
Anyway,
sorry, that's how it
I'm
has.
not going to interrupt you, Doc. I'm not going to interrupt you. What? Could you just repeat that again? Because sorry, did I say repeat that again? Because repeat mean again. And when you say it like that, it make me feel as if
Don't get stuck now, please.
Doc. Just
Please.
go ahead. Go ahead, Doc. Sorry.
Right. So basically, it's a part of the reproductive organ, and this is the organ in the female that actually produces the eggs in order for a fetus or a child to be born. Now we have two ovaries. Women have two ovaries, and they're basically small organs, round about the size of a walnut, and they're on either side of the uterus.
Mm-hmm.
And basically, they become most active in the reproductive years because every month a woman ovulates, usually from one ovary, one or the other. And when they get older, then the eggs are not they're not ovulated anymore because of the hormonal change. The normal hormones will wane as a woman gets older. So that's where the menopause comes in.
Hmm.
Now,
Men are
it's
pausing. Mm-hmm.
basically ovarian cancer is really not as common in black people, Hispanic or Asian people, is more common in Native Americans or the white population. But it doesn't mean that black people do not get ovarian cancer. They do. It's just not as common. So, what are the symptoms of ovarian cancer? Now, the problem with ovarian cancer is that the symptoms can develop and spread throughout the abdomen before you actually know that you have ovarian cancer. And
Wow.
that's the problem. You can have a large mass and no symptoms at all. And we know that the abdomen in a woman is that organ basically. You get pregnant and that fetus gets huge. So you can imagine that space in the abdomen, in the pelvis actually. And so the ovary can actually start to increase in size. That means the tumor cells are formed and it gets big and there's nothing. You have no symptoms. And
Wow.
that, even with all the studies that have been done, they're basically, we'll get to that in a little while. So we talked about the symptoms.
Right.
What are the symptoms of ovarian cancer? Usually you'll have discomfort in your abdomen or pelvis.
Right.
Lower abdomen, where you think your bladder is, you might get some discomfort there, bloating. You might get some changes in your eating habits, might meaning that you might feel full. early, or you might lose your appetite. Um, some women have a vaginal discharge or abnormal bleeding, and this is outside of your period or after you reach menopause. And you can have constipation or diarrhea, or just increase urination. That means you pee more often than usual. But what are the risk factors for ovarian cancer? What causes ovarian cancer? And the truth is that the cause of it is really not known.
Wow.
But there's some people who have a higher risk. For example, older women, women who are menopausal, over 50 years old, have a higher risk of getting ovarian cancer. People who are obese have a higher risk of getting cancer. There's a genetic predisposition to it, so you can actually inherit a gene. So if your family members have ovarian cancer, your mother, sister, close family members, it's advisable that you get tested to see if you have these gene mutations. And also, never been pregnant or even having children later in life
Hmm.
is a risk factor. Another risk factor is also the hormone replacement therapy can increase your risk of getting, and this is debatable, of getting ovarian cancer. And also endometriosis. Endometriosis is where, okay,
Sorry.
so basically
I should
endometriosis
give you a
is,
video. I should have you in a video format so we can see you and you could see me.
you could.
Yes. All right.
So endometriosis is where you have abnormal uterine tissue. So the uterine cells, or the cells from the uterus, can actually come out of the uterus and go on top of the uterus or the ovaries, and these are also risk factors for ovarian cancer. So we want to know, basically, how can you diagnose ovarian cancer? Because remember, we said ovarian cancer can be there for a while before it is detected. So
Okay.
it goes unnoticed, and so the cancer cells are developing, getting bigger, spreading, and it's not detected. So how can we diagnose ovarian cancer?
Yes.
Unfortunately, just like how we have breast cancer screening, cervical cancer screening, colon cancer screening, unfortunately, there's no ovarian cancer screening. And that's one of the issues, because, as I say, it's very hard to detect this cancer, or even to diagnose it in the early stages. Because if you don't have symptoms, you're never going to be going to your doctor for assistance, or for to complain about something. But if you suspect that something is wrong, your doctor might do a pelvic examination, and they're checking for any enlarged organs in the pelvis.
Wow.
And then they can send you for pelvic ultrasound, or you can do other testing like your MRI or CT scan, and possibly your PET scan if they suspect things are happening. There are other tests that you can use. There's a blood test called the CA-125, that they use to test for signs of cancer. But this test is not as specific, because even though you have cancer, this CA-125 may be normal, or it may be high in other forms of disease, and it's not cancer. So yes, you can use it as a screening test, but it's not the best thing. So the best thing would be basically to know your body. Know your body. It's important.
Wow.
The point is that women need to know you know what you feel like, you know what your abdomen feels like, you know if you're ovulating, you know what it feels like, um, anything that's outside of it. We tell a woman that she's always, everybody, especially women, do your breast ultrasound. No, you see your abdomen getting bigger. Don't just take it for granted that I'm probably gaining weight. Go ahead and get your check, and get your at least once a year, get your woman's evaluation.
Woman's evaluation, yes. Sounds
Yeah,
like a plan.
Of course.
Doc, I have two questions from viewers. One of our viewers on
Hmm.
YouTube asks, why does the living conditions contribute to the prevalence of ovarian cancer? And also, what is an example of hormone replacement?
The first question is why does go ahead.
The living conditions, why do they contribute to I think you mentioned that living conditions perhaps contribute to the prevalence. And then the other question is an example of hormone replacement.
Okay, so remember that women who are they want a name of a hormone replacement therapy.
Right.
This is the HRT, the hormone replacement therapy is the hormones that they use for people who are menopausal because your hormones, remember, as you get older, your estrogen, your progesterone, the estrogen that you normally produce for you to get for you to go through your cycle and your progesterone, all those decrease because of your age.
Right.
So what happens because of the menopausal symptoms, the hot flashes? Some people have really, really bad menopausal symptoms. Some people's menopausal symptoms are mild, that they only get the hot flashes, they have the insomnia. Some women get moody. Some women get very irritable. Their sleep is disturbed, and they are not able to function effectively in the days because it affects them in such a significant way. Your doctor might decide to replace these hormones, which are the estrogen or hormones that basically will stimulate the production of some of these or will
Yes.
mimic these hormones
Yeah.
in order to decrease the symptoms or to make the symptoms of your menopause a bit more tolerable. They'll decide how long you go on. It depends on what is happening with you. There are women who will use Botox, and there are other forms of therapy that they will use to assist the menopausal symptoms. So these are the hormone replacement. I'm not sure if they wanted an example,
Oh, oh yes,
but
yes.
this is what I'm talking about, a hormone therapy. But there are many things that you can use for that you can use to help that is not exactly drugs, but
Yes.
there are other things that you can use. You can use natural stuff. You can use black cohosh. You can use soy-based products. You
Yes.
can use, some people use evening primrose. There's a whole lot of hormonal therapy that you can actually use to help you with the symptoms. Because if you're not sleeping, remember that even with production of cancers are caused are implicated because of the way our body deals with the cells. So they're normal cells. And if we do not have a good immune system, then we're not going to be able to identify these cells and be able to get rid of these cells. Because remember, our immune system is what recognizes that you have an abnormal cell. Everybody's exposed to cancer cells.
Yeah.
Why does one person get it and the other person doesn't get it? It all depends on you, your body, your genes, your makeup. And that's why we encourage a healthy lifestyle.
Mm.
So sleeping is important. So if you're going through this and you're sleeping 1 hour, you're waking up, you're getting miserable, you're irritable, you're having the hot flashes, you're not able to sleep because you're sweating and you're just not can't fall asleep. You're sleeping 1 to 2 hours for the night. That's not good. That is going to be affecting the whole repair of your
So
cells. So yes, you're
how would one deal with that? Seeing finding a situation like that. What would be the solution or some solution to that situation?
But that is what we're saying. If you find that, okay, so you know that when you're going through menopause, because remember, you can be perimenopause and start these symptoms. So the entire symptoms do not start when your period has stopped. It starts way before the period has stopped. So if you know that you're going through these, the best thing to do is to nip it in the bud. Start addressing it as early as possible. So you might say, I want to take hormones, or I do not want to take hormones. So I want to go the natural way. Start taking these natural substances the moment you find that you're getting these symptoms. So when they actually, when the hormones actually, basically your estrogen, the production from your uterus, from your ovaries, basically wane to the point of none, and it doesn't really stop to zero, but it drops significantly, you would have actually start controlling these symptoms. So the best thing to do is to start taking early. Remember, it's a trial and error. What works for me? I might take black cohosh and I have the perfect, I'm good. And that does nothing for you.
Find somebody else take it
You
and
might
and make
take
them crazy.
evening primrose,
Yes.
exactly. So
Evening
it's a
primrose
matter
oil.
of,
Yes.
there are lots of herbal stuff out there,
Yeah.
and the point is that you do your research. I mean, I could tell you a whole lot of stuff, but it's a matter of
What works for
your
you? What works for you?
what works for you.
Yes.
So if that doesn't work
Trial
for
and
you,
error.
then you
Trial and
move to
error.
something else, and you move to
Troubleshooting it.
something else. But there are things that don't work for people. As I said, there are people have to go to their doctor, and your doctor is always going to, depending on your physician. A lot of doctors are not into
Herbal stuff.
herbal stuff.
Right.
So they're going to be pushing drugs on you. They're going to be pushing all these drugs on you, which already have side effects. As I said, the hormones that you use to control your menopausal symptoms have side effects, and the side effects might just be ovarian cancer. There are people who are going to say, okay, I don't want hormones, but I want to use Botox to help. So
Wow.
there are lots of other things that you can use to help. But listen to me, the main thing is to have a healthy lifestyle. Come out of your house, go get your vitamin D, exercise.
Yeah.
Exercise is important. It
Rest.
produces all these happy hormones. Happy hormones, it improves your immune system, and you'll be surprised the effect of just moving, sweating, working. I mean, you drinking your water,
Yeah.
going out there to get your sunshine, resting, stop stressing, trust
That's
in your God,
stop
try to
stressing,
deal with
doc.
Stop
stress.
Doc,
stressing.
did you say stop stressing? Is there a pill
Okay,
for
so
that?
stress is
Do you have
there,
a do you
but
have a
it's
stop
how you
stressing
deal
pill?
with it.
Do you have a stop
It's
stressing pill, huh?
it's how you deal with the stress. Nothing is wrong with having stress in your life, and stress is not a bad thing either. It's how you deal with it. And the problem is the prolonged stressful event that
Yes.
causes you.
Yes.
Yeah, you're going to,
Yeah.
you don't have any money. That's fine, and that's stressing you out. Or you're going through a divorce and it's stressing you out. But there are times when you can do some activity or something that will take your mind away from the stress. Do something that's fun. Hang out with your friends.
I would tell them to
Go.
hang out with me, Mikey G, at the breakfast
You
hour in the
know,
morning to reduce what you call it?
reduce the stress.
Reduce the stress.
But I have a question, Doc. I was surprised when you mentioned that actually going above the age of 50, as you're approaching menopause, you are at increased risk. I was
Thinking that it
hoping,
would have been the opposite.
I was thinking that it would have been the opposite. But I am wondering, though, if that affects the prognosis, whether being diagnosed premenopausal as opposed to postmenopausal or during the menopause period affects the prognosis or the outcome of ovarian cancer.
Actually, it really doesn't, it really doesn't affect the outcome of ovarian cancer. Whether you are diagnosed early, I mean, before menopause or after menopause. But remember, most people who have ovarian cancer are postmenopausal. You'll have a few people who are younger, but the majority of people who get menopause are supposed to be postmenopausal. But remember, these days nothing goes anymore.
Yeah.
Everything goes.
They're not.
That brings me to the next part of the question. So you are saying that childbearing also is a is a helpful factor in not getting ovarian cancer.
Yeah, ovarian cancer, breast cancer, uterine cancer, yes.
Childbearing is very important to that.
Yes, women who are nulliparous means that they've never had a child or had children later in
No,
life.
no, hold on. Nulliparous, doc, you mean that they choose not to have children or they couldn't have any?
For whatever reason they don't
Whichever
have.
one, for
Yes.
whatever reason, I
Oh, you
don't
mean that
know.
you can choose not to have it?
Nulliparous means you've never had it. It doesn't mean that you choose or you cannot. Whatever the reason is, that's what it means. So women who who have never been pregnant, or those who have had pregnancy much later in life, 40s,
Yes.
50s, well, 40s, let's put 35 to 40, they're at greater risk of having a number of the female related cancers.
Wow. Wow. What a thing.
Here is my next piece. Doc, you mentioned when women have menopause, at the menopausal cycle coming up and all that happening, they become a little bit unstable and stuff like that.
What is unstable?
That's what I was trying to get to. And I'm saying we have to work with some of these women, you know.
You know, Doc, I'm gonna ask you a big favor, right? I need those who have asked questions have said thank you. And I think the person clarified and asked if the area that you live in. When she asked
Oh,
Okay.
when she said living conditions,
Okay.
okay,
Right.
got you. Okay, yes, it does make a difference because remember, as I said to you, wherever, because of remember, you have different kinds of pollution, and these affect you. You have noise pollution, you have air pollution, you have um, lots of different kind of pollution here, but depends on where you live and your the activities that you can do
Exposure.
and what you're exposed to.
Yes.
Because remember, as I say to you, you are exposed to oxidative processes in your body.
Yes.
Means that the air that you breathe in goes in and actually
And
does
takes in chemicals with
no.
it.
No, we produce free radicals, and
Okay.
it's the free radicals that damage your system. The foods that you eat, the processed food that you eat, will go in, produces nitrates, which are free radicals, and those are the things that will damage your cells. So yes, you're living in a country where you're breathing free air, you're having the relaxation, you're living in a city where everywhere you go, you see a building, there are not much trees, there's movement, there's activity,
Ah.
there's light all the time, there's light pollution. That's why it's important. You live in a country where there's no, where you get, when night comes down, the
Night comes
light is
down.
off and everything is dark.
Night comes
That
down.
helps you with your end. Exactly. You're
Yeah.
living in the city. You're not seeing any darkness. There's light 24/7.
Wow.
That can actually affect you. So that's what I'm saying. Your living condition, yes, ma'am, your living condition, and if that's what you're saying, does affect your risk of getting a number of illnesses, not just cancer, but anything else.
Last
But
question, Doc.
Last question. Can I have the last question? When are you going to come back again? Because
No,
no,
Doc is coming back
you
next
start,
week. She's next week. She'll be back next week
right, because you'd have to deal with
for
menopause separately. Menopause is a total separate thing that you would have to address
we
differently.
we
Yeah.
we can talk about that next week. We can talk about menopause. We can talk about menopause in female, and we can talk about the symptoms happening in men also.
Andropause.
what
Yeah.
is menopause in men? No, listen. Let's don't mix up the men in these things. Look here, girls, ladies.
All right, please. Can you wait until when?
All right,
What
let
is
me-
your last question?
My last question, Doc. Can I have my last question? Lady Elise had her last question. Did you have your last question?
Yes,
Andrew?
I did.
Doc, I'm going to ask a last question. You mentioned a signed womanhood.
Oh, jeez. Yes, sir. Assigned womanhood. I never talked about that. I
No, no,
said,
no, no. You mentioned no,
um,
no. Let me no. You didn't talk about it. Let me tell you what the statements. And I'm
I
trying to
said
paraphrase it.
ovarian cancer occurs in women who are assigned female at birth. That's what I said.
Yeah, I'm saying that's what I'm saying. That the women are assigned female at birth, and that's I caught it. I'm a little pad here. I'm
You
writing
wrote
down.
it down.
I wrote it down
You wrote
because
it down.
do you have women who are not
Let me see
assigned?
it.
Are not
Let
assigned.
me see your paper.
I have it right here. See there. All right, Doc, don't get into it. I'm going to leave it right there. Thank you, Doc, for coming on this morning and help us.
The other thing that you had asked,
Yes.
Elise, about the premenopausal and postmenopausal women with ovarian cancer, the postmenopausal women tend to have a poorer outcome
Oh
than the
man.
premenopausal women. But the risk, the risk is, I'm not sure what the risk is, but yes, they do have a slightly poorer outcome if you get ovarian cancer after you reach menopause as before you reach
Oh
menopause.
wow. That's a mouthful. I want to thank you, Dr. Lewis. I have really been, and I believe our viewers too. The chat is very active. Persons are listening. Persons have gotten the information. Today is celebrated worldwide as Ovarian Cancer Awareness Day,
Yeah.
and this is how we fight things is by being informed, taking care of our health, as doctor remind us that we ought to. Any final words, Mikey G?
Well, no, I'm still at the assigned women stuff, so I'm not going
All
to
right,
pass
so
it.
the final
And I don't
words
think Doc
then
want to talk about
would
that, so
come
I'm
from
going to leave it.
our
So,
doctor.
Doc,
Any
yes.
any final words do you want to say to
Any
our
advice? Any
listeners?
advice to the men, especially, how to stay away from
No,
menopausal
I'm glad you said no, I'm glad you said that, because although we are speaking about ovarian cancer, be
conditions?
aware that when we are speaking, it's not in isolation. You have a daughter, you have a sister, you have a mother, you have an aunt. So the
You have
knowledge
a
is
friend.
a friend. The knowledge is not female only.
Oriented. It is
Yes,
everybody,
it is for
every single
everybody.
person who
So
you love.
awareness
Right.
of ovarian cancer stretches across,
Cross.
whether you're assigned female,
Get that one out yet.
anyways,
Leaving
or
it right there.
assigned male.
Doc, any last words, any bit of advice to the men, especially about this condition? If you say it affects men, could you just any advice to the men as you go?
Oh, ovarian cancer does not affect men. It
No, no,
affects the
no,
women that you
not
love.
ovarian cancer. They assigned women. If you say they are assigned women, aren't they assigned men? Doc, you know what?
You know
Anyway,
what? Let's move in for that. But and the thing about it is that ovarian cancer is one of those cancers that it's a little hard to detect,
hmm,
and so knowing your body and husbands, know your wives, know them. You see something,
yeah.
you notice that her tummy looks a little bloated. Talk to her. What happened? Are you gaining weight, or is something else happening to you? And we can check it out together. You notice that she's having abnormal bleeding when she's menopausal and she's not supposed to be doing that. Encourage her to go to the doctor. This is not right. This is not
Hmm,
normal.
hmm,
So get involved in your wife. Get involved in the. I mean, you might not be knowing that thing about your mother or your sister or friends, but be supportive. Be supportive. Be there for them. Try to get them to live healthier lives. Try to get them to do the things that will keep them healthy. Sleeping, they complain to you that they're not sleeping properly. Try to get assistance. Why aren't you sleeping properly? Be there as their source of comfort, that they can release some of their stresses. You can help them to de-stress, help them to find coping skills for whatever is happening with their life. Be there for them, because remember, the same um, pathology or the same things that predispose you to get ovarian cancer are basically the same things that they predispose you to get a lot of other illness. We can't overemphasize just living healthy. Water, sleeping, eating properly, getting your antioxidants, handling your stress. It's the same thing that affects every system in our body. It is. And once we'll try to be as healthy as possible, then life happens, but it's how we deal with it.
Thank you so much.
Thank you, Doc, for such big information today. Men and women are benefiting, boys and girls. You hear it right here on Flashpoint. Dr. Karen Lewis this morning. Of course, she'll be joining us next week for another topic that we'll be talking about. Of course, we'll be, telling you the topic we'll be talking about later on. And when she comes on, you can have your questions ready to ask next week. Thank you, Doc, for coming on this morning. Flashpoint. Have yourself a wonderful day. Because it's important for the housekeeping to take place. So I will say this segment of the breakfast hour is brought to you by Asai Ultrasound for all your ultrasound needs right here in the Grand Cayman Islands.
If that stomach is bloated, you need to have your ultrasound scanned.
If you have that stomach bloated right now, get to your doctor, have them give you a referral to Asai Ultrasound to see if you're having a situation of ovarian or other things that may happen, because you might go for one thing and find out that something else is, or there's false alarm. So just check it out, guys. Asai Ultrasound is the place to be. Tell your doc to refer you to that location, because they have the experience to give you the best lab information for your doctors.
Yes. And also, if you're tuned in right now, what about a thumbs up and a like and a share?
Yeah, man. Share to somebody. Thumbs up for that. And of course, this morning, World's Ovarian Cancer Day. And of course, we're talking about it right here on Flashpoint. And no worries, guys. We'll keep the information flowing for you.
When you need ultrasound that's safe and effective, you must visit Asai Ultrasound Imaging. They're conveniently located at number 4 Chestnut Center, Smith Road, Georgetown, Cayman Islands. With experienced technologists with over 20 years experience, their friendly staff will make you comfortable while you get your procedure done. Asai Ultrasound Imaging is open Mondays to Fridays, 9 a.m. to 5 p.m. and 9 a.m. to 1 p.m. on Saturdays. Call Asai Ultrasound Imaging 345-949-2454 or 345-938-3426. That's 345-949-2454 or 345-938-3426.
Asai Ultrasound for all your ultrasound needs right here in the Grand Cayman Islands, and for checking out some ovarian cancer. Guys, don't worry, you don't have to check on it. For those assigned men, go look about it. Because you're assigned men mean you have ovaries. You're going to be having some ovarian stuff going on. Guys, you know,
I have a listener say if I should come in for my belly. A male. Assigned male.
Come on, guys. If you're assigned male at birth, then you don't.
You can still come in for your belly.
No.
Because we
not
at the belly.
Not for ovarian.
But not for ovarian.
Not for ovarian. For your God's sake. For your